So, Bob, in all of the debates we put on, we try to pick issues where there's some kind of real trade-off. In this debate, what are the trade-offs that we're talking about?
Well, the major one here, of course, the FDA's job is to see that drugs that come on market are both effective and safe. And that's a worthy goal. But the longer it takes to get a drug approved, the more arduous that process, the more people don't get the drug who might need it, in some cases with absolutely dire or fatal consequences. So there are huge costs to delay, just as there are huge benefits to protecting the market from unsafe drugs.
This agency that we're talking about, the Federal Food and Drug Administration, has roots that go back to 1906, Teddy Roosevelt era. Science was at a different place then. How much is the advancement of science actually part of what this debate is about?
Well, I think the advance of science is a very key part of the debate because so many of the drug therapies operate on a molecular level, where our genetic composition is an important determinant of how the drug is going to affect our bodies. And that means that the old paradigm of trying to figure out a drug that does good for everybody and harm to very few people is really kind of outmoded. The better paradigm today is the really custom-tailored drug that takes one's own individual genetic composition into effect. And the pro-the-motion side is probably going to say that the FDA simply hasn't adapted to that degree of scientific advance.
What about the other side?
Well, the other side is going to say this requires larger tests, bigger sample groups, more amount of time to really winnow out these individual differences in response.
Well, we have 4 debaters who have not only been arguing this debate, but some of them have actually been involved with the FDA directly, so they're going to know what they're talking about. Let's welcome them to the stage. Ladies and gentlemen, our debaters.